we wanted to give you an update since this morning, as our laboratory has identified that we have 3 more additional cases of COVID-19 here in BC. So I reported on what was our case 9 this morning, a man in his 50s in the Fraser Health region who has returned from travel to Iran. Case 10 is very similarly a man in his 60s who also returned from travel to Iran and is in the Vancouver coastal health region. He had a very small number of contacts, and he's in isolation at home, as are the close contacts, and being investigated and followed up with Vancouver Coastal Health. Our case 11 is an adult woman, and we've just got limited information on her at the moment. Also have recently traveled to Iran and is in the Vancouver Coastal Health region, and Vancouver Coastal is actively investigating that case even as we speak. She is in isolation at home, and the follow-up is being done. And finally, our case 12 here in British Columbia is a woman in her 30s who is a household contact of case 8. So it was somebody who was in isolation because she had been a close contact of the woman in her 60s who had returned here from Iran, and she developed some symptoms while in isolation and in her monitoring period, and was assessed and tested and has tested positive. So that is not surprising. I think it's a reflection of the work that we do in public health, that we want people to, if they have had an exposure, we want to be sure that they're in isolation if and when they develop symptoms, so they can be safely assessed and tested. And in this case, she is also in isolation at home. None of the cases today have needed hospitalization, so all of them are being followed actively at home.
Fortunately, all of our cases have consistently either got well at home or are currently at home, which indicates that they are stable.